today have been part of these conversations around providing sheltering, dealing with issues of gender-based violence. And this gives us some insight into what the so-called new normal looks like in the face of pandemics or climate change, whatever it might be, climate disaster that we are looking at. So this is an important piece of research into sheltering in South Africa. Again, just to introduce myself, my name is Thokozile Madonko, and I'm going to just very briefly explain how we will proceed. So we, unfortunately, just in terms of time, we won't be able to do a round because we're very excited to have over 65 people on this webinar at the moment. And if this was in person, you would have met by the tea and the scones and the fruit and the coffee and, you know, had a little chat and catch up. And I'm sorry that we cannot provide that platform, but it doesn't stop you from after this webinar giving someone a call and saying, gosh, what did you think? What did you learn? How did that impact you? So we can still create the little water cooler around the coffee station effect by touching base after the webinar in different ways, an email, a call, a WhatsApp message that can remind yourselves of doing that. What you can do is please use the chat function and you can just say where you're from, your organization, who you are, and we will be monitoring the chat function throughout the session. And also, if you have any, because of the limited time and because of the number of people on the platform, we do want to be able to use the chat function as an opportunity for you to write your ideas down. Just say idea and then write it down, or question, write it down, so that we can keep track, the team that is monitoring the conversations. We don't want to lose your input or your thoughts and ideas. That's really important. So even though this is a virtual space, I want you to just take a moment and either move to the front of your chair if you're sitting at a chair and it's safe to do so, or if you are sitting in the front of your chair, move back. If you're using your phone, maybe angle yourself a little bit differently. I just want you to shift. I want you to now land in this place. Take a deep breath in, bring up the shoulders, because you're going to be in this virtual room. Imagine the coffee's brewing in the background. And we're going to have a little opening session by my colleague Claudia. We will then have Lisa Vetten, who needs no introduction, but will get an introduction nonetheless. We'll be presenting the findings of the virtual brief 2. I mean, the brief 2, it's not a virtual brief, the brief is done. And then we have 2 respondents that will be a facilitated discussion, Fasani Maslangu, which she introduced herself for those of you who were here, and Mr. Sibusiso Malope. And then we will take some question and answers. But when I say questions and answers, it's not that there will be questions and answers of clarity for the findings and for the brief. But make no mistake, we are all experts in where we're situated. And so let's use the questions, and if there are answers, to facilitate better questions or to get us thinking about how we find the answers. So it's less of a kind of us sitting here and you there. So it's really interactive. This is the platform we're aiming for today. So in that light, I would like you to just really feel free to put down whatever you are juggling. Put it down. Put that email down that you haven't sent yet. The kid that needs to be fed later. The journey that you have to do to get home, and just be with us for the next hour and a half and really engage on something that I know is very close to everybody's kind of soul, activist, and intellectual work. So without any further delays, I wanted to kick off with a little reading just to get everybody thinking and the juices flowing. You can even close your eyes if it's safe to do so. And this I took from an article written about Pumla Kola's book, The Fear Factory. Intimacy is not a level playing field. We don't think enough outside thinking about how intimacy is a mind field of things. Intimacy in itself does not collapse the power disparities between people in a relationship. We need to understand how intimate spaces and relations, the home, the family, and romantic relationships are in fact the primary sites of violence. And the reason why I wanted to kick off with that is that much of the work that the sheltering does is go straight into the heart of one of the primary sites of violence. Claudia.
Thank you, Toko. Good day, everyone. Sorry, I'm just trying to manage something. Thank you, everyone, for joining us. As of this morning, I think we had about 130 people registered, and we've had an amazing turnout thus far. So welcome, everyone, to the space. I know you've joined us for the launch of the second research brief related to care and supports in the Time of Epidemic research project. It truly means a lot to us that you've put aside this time for the next hour and a half during an incredibly busy time of year. Sorry, I'm also busy letting in people. So talk over a few, but I hope you have host rights to get people in. No, you don't.
I don't, yeah.
All right, but let me go on. So care and support in a time of epidemic is a research project that was initiated towards the latter end of 2020 in partnership with the National Shelter Movement of South Africa and led by researchers Lisa Betten and Kailash Banner. What we haven't let you know earlier today is that Kailash was going to moderate, but unfortunately her child is sick and may likely have COVID. And we're hoping she's trying to join us, but she might pop in, but yeah, thinking about her. So the project aims to better understand how COVID-19 and the subsequent implementation of lockdown has impacted on the incidences, experiences, and responses to domestic violence and other forms of gender-based violence in the country. Now, focusing on gender-based violence has been a core component of the human rights program of the Heinrich Böll for several years now. We have supported and partnered with a range of organizations and activists in their work to prevent and respond to GBV, with a particular emphasis on efforts to addressing domestic violence and intimate partner violence. Throughout this work in our partnership with the National Shelter Movement, which stems as far back as 2012 through 2 research-focused projects, we've built a solid body of evidence and an understanding of what it is like and what it takes to provide shelter services for those who are in great need. We are also intimately aware of the challenges that doing so presents to this sector. Shelters are a lifeline for many victims of crime and violence. Many of you in the room are shelters. You know very well what this means. Often these are women who have experienced intimate partner violence, family violence, have been sexually violated by persons unknown to them, amongst many other circumstances that leave them in great turmoil. They arrive at shelters often with young children and with a great many needs beyond that of merely having a roof over their heads, a bed to lie in, and food to eat. They're in great need of safety and security, for comfort and care, and have a range of practical, legal, and medical needs. These needs are often extensive, requiring much support and guidance from helping them to apply for social grants or renewing identity documents when these may have been left behind or been taken from them. Helping them to apply for protection order, magistrate's court, or laying a charge of abuse, helping them contend with the criminal justice system that is not always as responsive as they should be at first. They often require medical care and attention, not only to attend to injuries when these are present, but also need regular attention to care for chronic health needs. the children too have a great many needs. And then, of course, there's also the needs to find employment and where to go on from the temporary reprieve that shelters provide. The shelters play an absolutely incredible role in helping to rebuild and restore and to break in the cycle of violence. And they do this often with very limited support, which places a great deal of pressure on the ability to provide the range of programs and services that residents need. And then COVID hit in a time of great upheaval, uncertainty, and fear prevailed the world over. I was thinking back yesterday as I was kind of preparing what to say today about what the early stages of lockdown was like. The anxiety of not knowing what was to happen, the fear of not being able to see that which was killing us as well. Yeah, killing many people. And certainly for me, this time also brought a fair amount of panic and also despair. But for some, this brought many, many other socioeconomic, physical, and psychological hardships. Having worked in the GBV sector all of my working career, at the time it also brought great concern for me for those locked in with the users. I remember very well the first call for help. It was a few days into lockdown and a message popped up on a GBV focused WhatsApp group. It was from a university professor who was asking for guidance on what to do. Her sister had been badly assaulted by a substance addicted brother on day one of lockdown. At first, she contacted the GBV Command Center and told her she needed to report the matter to the police. Citing against this, that she'd been badly injured, she headed to a local hospital, which she's eventually seen several hours later. She's been told her leg has been fractured. Her next port of call, with crutches in hand, was to head to the police station. At the station, the police tell her she should go home. They will come take a statement from her later. They do arrive that evening, but leave after telling her husband that she needs to go back to the police station to collect a J88 form. She then is to take this form back to the same hospital she was at, and then to go back to the police station so that she could lay a charge. She's been told that this is the only way she can do so. So now on day 3 of lockdown, she's finally able to lay a charge. The police eventually arrive at her house, but her brother is not arrested for physically assaulting her. Is merely given a stern warning. So this was but a few of several other requests for help that followed in the days and weeks after in some of the WhatsApp groups that I was part of. We were also being confronted with media reporting during this time. It was overall a time of greater uncertainty, but also spurred on by conflicting information. The Sun source reporting significant increases in violence and services reporting being overwhelmed and unable to cope. Well, this was not the case for others who presented a different picture. So it had us thinking what was really happening. What were victims' experiences during this time? What impact did lockdown have on help seeking? Had measures set out to respond to victims' experiences of violence been functional? Did they enhance or constrain? And how were those providing forms of care work, such as shelters that already have to contend with many challenges, faring during this time? So having a more in-depth understanding of what was happening beyond the headlines, conflicting information, and the panic would essentially help us think through more effective ways of intervening both now and in the future. So whereas the first brief we launched earlier this year looked at the available evidence for violence, looking at police statistics, National Command Center statistics, and health facilities, the brief we launched today provides a more contextualized account and exploration of what it was like to provide an essential service, of what it was like to present an essential service during lockdown, and how various other actors and processes, including government departments, the private sector, and the funders contributed to this. In future, the launch of a final research report next year, you'll hear a far more personalized account from the perspective of shelter workers and those making use of these services. But for now, I hand this platform back to Toko, who will be followed by Lisa, who will take us through the findings. Many thanks, Toko.
Thank you so much, Claudia, for setting the scene and for reminding us that the journey we're taking collectively. And I've just taken an opportunity to have a look at the chat, and we have a broad range of representatives from across the sector. So I really do hope we will have input and discussions around what it's like to do this work in rural areas versus urban. I see that distinction, different components of the work, social workers, psychologists, shelter managers, and so forth. So we welcome you And I now have the pleasure to, I always want to say Professor, all high being Lisa Vetten, and she was the lead research consultant for this project. And she's also a researcher in the Faculty of Humanities at the University of Johannesburg, and in particular the UJ's Gender Violence and Urban Transformation in India and South Africa study, as well as a research associate at Wits University, Southern Center for Inequality Study, and is always incredibly giving of her time when there are questions and discussions of policy, of law, of activism. So Lisa will be introducing the presentation. And again, we are thinking of Kailash and her family, and wish she was with us today, who was the co-author on this work. So over to you, Lisa.
Thanks. Oh gosh, now I've got a view off the top of my head. Good morning, everybody, and thank you so much for making the time. It's really wonderful to see so many shelters here, because this research in many ways is a tribute to yourselves and to the hard work and struggle that went into trying to keep services going during the lockdown, during its most difficult phases, and it's still going on now. I think we also have a couple of donors, as well as some people from Department of Social Development. I also want to acknowledge your presence in terms of, I think, being able to acknowledge where things were helpful and where we need to think differently in future. I mean, a disaster is an unprecedented event. You don't expect people to know exactly what to do immediately. You do expect a little bit of fumbling and uncertainty initially. And I think what we've seen is ways in which people did adapt to that over time. And we've seen, most unfortunately, those who are unable to change even when they are confronted with disaster. So this particular presentation is really going to focus on looking at, in some ways, the kind of regulatory or policy framework that was put in place to assist shelters. How did it work, and where does it start to point us in terms of thinking about how do we respond in future? Because some of the problems we're seeing here are new, some of them are not. They are old fault lines. So what we're saying hasn't gone away. It's still here and still needs to be addressed. So I'll be going through some of that in the presentation, which I am now going to attempt to share. Can you see it?
Yeah.
Yes, we can
Okay.
see it.
Great. Let me just get it to. Okay. So as I said, my colleague Kailash Barner worked with me on this. She's unfortunately not here today. And one also wants to obviously acknowledge all the shelters who contributed to the study. We had 27 from 8 provinces. They were all, but for one, members of the national shelter movement. We decided to focus on them because they are relatively organized, and because the bulk of sheltering in this country is provided by the NGO sector, we decided to focus on that rather than government. And there are also enormous complexities in trying to get permission to interview government services. So for both convenience and I think because this is where the bulk of shelters were working, we focused on the national shelter movement. So these 27 shelters, we sent out an invitation to participate, and this was the response that we got back. And ultimately, we undertook 36 different interviews. So 31 were with shelter workers, some of whom were also provincial coordinators, which was useful because they were able to give us a bigger picture beyond their shelter. They sometimes were able to give a bird's eye view of the province. Then we also interviewed 2 members of the National Shelter Movement Executive Committee, and then added 3 key informant interviews. A community activist, which was important in, I think, giving us a sense of some of the experiences of those not in shelters trying to get women to shelters, as well as somebody who's been working in the field for a really, really long time, funding and supporting shelters. And lastly, a senior official in national DSP. Felt that was really important to get a sense of what were they thinking, where were they coming from, what were the decisions they were making, and why were they making those decisions. So there's an enormously rich amount of data that came out that deals with things like the personal impact of working during the lockdown, how people had to adapt counseling methods and approaches, what they thought that did to the way in which they were able to have an effect on women and children. But that's going to be for our longer report. This is going to focus predominantly on the regulatory framework And we'll also be engaging with the women's experiences of shelters in the long report. So it doesn't necessarily at this point reflect on how they may have experienced the system. This is very much about work at the level of policy and response. So I think the things that we have to look at in terms of disaster is that it creates a very disruptive milieu in which you need to work. Firstly, what shelter residents need doesn't alter dramatically. They still need protection orders, they still need child support grants, they may still need their children to be shifted to new schools. Very, very difficult under a lockdown. They still need healthcare. So all those things remain. But what is different and radically alters is the way in which you try and do your work. So your working conditions change very, very dramatically. Firstly, because there's a very high degree of uncertainty and unpredictability. When the pandemic hit, we had very little idea of if we know where we are now, we had very little idea of what it looked like then, what to do. There was very limited knowledge. We didn't know terribly much about effective responses. And all we kind of knew was that the usual way we do things aren't going to work. So a very high degree of uncertainty and unpredictability. And it's also rapid and urgent. So the situation changes constantly. What was working today, 2 days later, you might be hearing is something different, and you've got to respond on your feet rapidly. So the luxury of sitting back, going off and researching what is the best solution, how shall we do it, that doesn't exist. So planning and preparation do to some extent fall a little bit by the wayside. It also places very urgent, concrete and material demands on you. So, and you'll see this later, there are new costs that come into effect that one doesn't necessarily anticipate. You also need people in ways you didn't know you needed beforehand. And you need this at a range of scales. It might be at local level, but sometimes it needs to run from local to national. And as you'll see, we saw at some instances, we had these scales running from local to global. And it's also got to take place in an emotional milieu that's having a very strong effect on people. There was, I think, especially at the beginning of the lockdown, fear of dying because nobody knew what was going to happen. How did you deal with this? How did you deal with this? There was no vaccine. There's a great deal of panic. What should we do? And anxiety. How do we handle this? Not only about doing their work, but I think the other anxiety in this instance was also going to be about how are we going to manage all these women we've been warned are going to need services very suddenly. So it's a difficult environment that affects you at all levels, the emotional, the cognitive, the economic, the thinking, the planning, all of that. It's like having the rug pulled out from under your feet and you needing to think on your feet very rapidly. So it calls forth a lot of challenges in people. It really asks them to rise to the occasion in new and different ways. So this focus is really on how did they do so? Who was able to adapt and who wasn't? And how did people go about adapting? So in putting this together, it became very much a story in two parts where you can see both adaptation and you can see fixity and fault lines and no change happening. So in looking at how shelter workers were describing this, we could see that there are roughly two stories here. We called the one presence, being present. When people are present, they're here, they're recognizing what's going on, they're available, they're doing what they can. The second part of the story is one about absence, where people should be but are not. So these these kind of mapped onto, I don't want to suggest nice, neat, linear stages, but they kind of mapped on these different phases that the response went through. So that's how I'm going to structure the presentation, is following these phases. And you'll see in the beginning, the response is considerably more positive and supportive than we see as the lockdown continues and persists. And that's really, I think, raises questions about the now. So this is not only about what happened, it's about the now as well. So if we start with, we are running around like headless chickens. This is very much the state of panic. What should we do? And here you can see how very rapidly things moved in the space of roughly 8 days. So national disaster declared on the 15th, 18th of March, the regulations appear. The first time we see any direction given to shelters around how they should operate comes from Gauteng DSD. And what is also important is that this is at the request of the Gauteng Occupational Health and Safety Committee. And from what we can see, this is the only time it would appear that anybody in or structure, when I mean a body, a structure in the country actually thought that this was an occupational health and safety issue, that shelter staff were workers whose occupational health and safety needed to be protected. I mean, perhaps there were other provinces who thought about it, but Gauteng committee seems to have been unusual. And Gauteng DSD comes up with the suggestion of a two-stage model. There'll be 4 shelters in the province who will serve as quarantine. All women and children will be channeled to those 4. They will remain there, and then after 2 weeks, they'll be moved to other longer stay shelters. By the 23rd, the lockdown is announced. On the 24th, Minister Lindiwe Zulu has a press briefing, and she's talking about that shelters will be available as part of the other response to GBV, which will be protection orders and will be the Gender-Based Violence Command Center. And there's on the 25th of March, the lockdown regulations are issued. And I think one of the things that we can learn from this is that there was a great deal of confusion, and the communication on this wasn't necessarily as clear as it needed to be. So there was confusion around, are shelters essential services or not? And if you look at the lockdown regulations that deal with essential services, they talk about care services and social relief of distress to older persons, persons with disabilities, the sick and children, but there's no mention of shelters for victims of crime and violence. It's not explicit. So that is one site where I think confusion could have been avoided, because not everybody necessarily listens to what to ministers' press statements, unfortunately, nor reads their media statements either. So there was a great deal of confusion, and by the 26th of March, you can see we track, in terms of tracking some of the correspondence. You have the call to action collective writing to the ministers of health and social development saying what's happening. You have Total Shutdown organizing a webinar around this has been forgotten. Research released by Columbia University at the beginning of this year is actually saying, no, they interviewed people who said that shelters closed. So there was clearly a great deal of confusion around what was happening and what to be done and what the system would be. So I think that's lesson number 1, is how do we communicate better in order to prevent that kind of confusion. But the importance of that is it pushed, I think, NSM, the National Shelter Movement, to think we need to start self-organizing. We need to start making it very clear that services are available. They put out their press release. They start putting out information around where shelter services are going to be available. But you'll also notice this, it's a day before the lockdown. And with the regulations issued, it basically gives people a day in which to sort out who's going to be working and who's not, who's going to need permits, and they've got a day in which to get their permits, money if they've got it in order to go and buy food for the shelter, money if they've got it to go and buy PPE. So hence I think as one person summed it up very accurately, we were all running around like headless chickens, trying to get everything in place around what needs to be done. So the lockdown began on the 27th, and I think although the fear was there, now it really kicks in, of people being very frightened about what was going to happen. And there were these two questions. How do you manage a communal and residential facility during an epidemic? How do you keep both residents and staff safe? And secondly, how do you do that in a context where you're not only trying to manage the existing situation, but where you've also been told there is going to be a very significant increase in the demand of shelter services? So these are the two questions, and there is unfortunately not a lot of guidance at this point around what to do. So National DSD did think about these problems, and when they issued their directions, they really just talk about providing PPE, but they don't give actual guidance around how do you do this. And I mean, I think the DSD did recognize that shelters are small. We don't give them enough funding. If we start demanding that they have to have quarantine and isolation facilities before they're allowed to operate, most shelters are going to be closing. So the decision they took was not, and the other option, which was available in the lockdown, in the state of disaster regulations, was to use the kind of mass quarantine facilities that could be set up by the Department of Public Works. But I think they took correctly the right decision that taking those who just had to flee their homes from violence and sticking them into these great big anonymous impersonal mass quarantine facilities was not a great idea. So they didn't decide to go that route either. But it did mean shelters started off with no guidance around, to give you some of the very practical questions people were grappling with. What about toilets? How do we sanitize toilets? Do they need to be sanitized? What about baths? How do we sanitize baths and showers? How often must we sanitize? What about doorknobs? Where do we put an isolation facility? Our shelter is small. It has 4 rooms. We take 12 women. If we practice social distancing, that means we can only take 2 women. So we halve. What do we do? And there was no real guidance on that at all. So what one saw instead was how provinces chose to respond. And they were very, very, very different. So the Western Cape stands out. It was unusual. It is the only province that actually sat down with shelters and tried to say, let's think about this together and come up with shared ways of working. In other provinces, you know, for example, in Northwest, they had a visit from DSD who took them through PPE training, showed them everything. That was the one shelter. The other shelter never heard from DSD once, except to demand statistics from them. And this was the situation, I think, through much of the rest of the country. Some shelters never got anything at all from their provincial DSDs. I'm thinking of the Eastern Cape, for instance. KwaZulu was another one, a very good coordinator from the COVID team who seems to have been very helpful to the shelter. Others who said, we got nothing. The same thing with PPE. Procurement seems to have slowed things down, but very, very little provided by government. Again, it depended on what people got from donations, if the shelter had money to buy, if the staff had their own money to buy. And I think what came out of this, and I want to go back to the 3 things that Minister Zulu highlighted. She talked about protection orders, she talked about the GBV command center, and she talked about shelters. The missing response there was health. And the Department of Health emerges as being very important and overlooked in this response, because in many ways, they were the ones who were assisting shelters. They were providing them with protocols, they were providing them with guidance, they were providing them with guidelines and training, they were providing them with PPE. And what is also really important is that they were taking women to shelters and referring women to shelters. They were important and they were overlooked. So a lesson to take forward. And I mean, I think you had situations where shelters were even making their own masks and their own sanitizer from recipes that they'd found off the internet or that somebody had shared with them.
Lisa, 15 minutes.
Okay. So at that point, the provinces start establishing WhatsApp groups in order to share information with each other. And they go on an extensive media campaign because there has been this expectation raised that there is going to be a crisis. But the women are not arriving at the shelters. And so they're very worried that there's confusion around whether they're open or closed, because 4 shelters did actually close in the beginning, has meant that people think they have to suffer in silence and stay at home. So they do that. But they're also looking at how do we assist our members. And I think what becomes very important, and here you can see them starting to do this in April, but it really starts to come together in May and June, is starting to look at how do they solve their problems of how do they work and keep everybody safe. So what's really important is that Uber comes in. It offers 3,350 free trips in the provinces of Gauteng, Western Cape, KZN, and Eastern Cape. That solves the problem of safe transport in those 3 provinces, because you're not getting the police bringing women to the shelters as often as you want. It's happening in some provinces, not in others. So with the intervention of Uber, it means that women can now get from their homes to the shelters. It means women can be taken to health facilities, they can be taken to courts, they can be taken to wherever else they need to go without having to use public transport and expose themselves to possible infection. The same with staff. So that helps to start reducing the costs. And I think just to give you a sense of what the costs of transport to keep people safe massively increased under the lockdown. This came from one shelter. In 2019-20, they were spent just over 46,000 Rand on transport. During that year of lockdown, it increased by more than 3 times to 168,000. Shelters didn't have this money, and this is the important point, is no additional funding was made available for the increase to their costs. And this is a major thing to think about. Why no money was made available if we're expecting this massive influx in women. And even if we anticipated the number of women to be exactly the same, there was still going to be increased costs anyway. There's the safe transport. There's the question that now people are confined into one place. So there's an increased use of water and electricities and food. You've also got staff living in who are also adding to those costs because they're living in order to reduce their travel and their risk of exposure. There are also times where women can't use clinics. The hospitals are saying we're not available, that's not open, we can't get there. Testing is taking a very long time to the public health facilities, but sometimes you do need to test to see, should we shut the shelter down? Because that means removing beds from circulation for 2 weeks and it puts an enormous strain on residents and staff. You typically have to then, you send all the staff home, you have one person who's then doing 2 or 3 people's work. So access to private healthcare becomes important. Data costs, everything's moved online. If you've got children, how do you help them to try and stay up to date with their schooling? How do you pay for that? The paper and printing costs that are needed for children to be able to do their work. So as I said, Uber stepped in, and this was part of something they did globally, where they partnered with a number of countries around the world in which they were and domestic violence organizations in order to offer free trips. I think what was absolutely key was the Solidarity Fund's intervention. And you can see what these costs incurred. I mean, I didn't mention PPE, but do not forget PPE. That it cost over 7.5 million rand for the 78 shelters to provide these issues, to provide safe transport for those in shelters in the provinces where there was no Uber, for ensuring that shelters always had PPE, and for ensuring that there were access to healthcare tests and the like. And I think, it's important just to put this into context. Even with all that assistance, there were still 16 out of our 27 shelters who did have infections. And there was also one shelter with 2 deaths. I want to raise that because I think it does point to, it could have been, who knows, let's speculate, but it could have been a lot worse if that help hadn't been there. Also really important who stepped in was the Charlie's Tour on Africa Outreach Project. Very important when parts of when provincial DSDs didn't fund shelters for 6 months. And what this set off was what we would call, instead of a vicious cycle, a virtuous cycle. So it generated further funding from Ford Foundation, which assisted the National Shelter Movement to set up its own helpline in December of last year. It saw Anglo Gold Ashanti and the Alma Foundation also stepping in with funding. So this is a very good example of adaptation, where people respond quickly, look for resources, and people step in and step up. And it sets off this virtuous cycle that enables the shelters to get through this very difficult period. And you can see the effect that they had a membership of 78 members at the start of the lockdown. It's now gone on to 98. That's other shelters observing how people will self-organize and be present and step up for you. Hence that the shelter movement came through for us. So that's the happy story. That's a story of adaptation in the best possible ways in a very difficult situation. But I want to talk now a little bit about absence and the different story. So the first way we can summarize it is if we look at shelters admission rates. We looked at 6 months, the first 6 months of lockdown, we moved from level 5 to level 1. We looked at 25 shelters. And those 25 shelters, and bear in mind, we said that the full national shelter movement has 78, and there are actually more shelters, but just those 25 alone assisted 1,028 adults and children in that 6-month period. Those were new admissions. These were relatively small shelters, so you can get a sense of how busy they were. And the busiest month was August, where roughly 1 in 5 admissions were coming in August. What was important is that 11 shelters, and here you can see that why some shelters are saying, where are the women? Because they filled up, the number of women new admissions was equivalent to filling up the shelter once or 1.6 times during those 6 months. 7 shelters had enough admissions to fill up the shelters twice or more. The maximum was a shelter who filled up 10 times in the space of 6 months. And there are 4 shelters who were incredibly busy. 4 of them accounted for over half of admissions, 554. And that was the result of channeling. So one of them is the Western Cape shelter that was acting as a stage 1 or quarantine facility, where so 4 of them, everybody was going there before being sent out to a stage 2 after 2-week quarantine. So some of that busyness is explained by channeling, that some shelters were getting women from across the province. And the other thing, and this is where we start to talk about absence, was because there was an unavailability of DSD services. So this brings us to one shelter's rather pointed and sharp observation when she reflected over the 6 months, and her point was, we should all die equally. And this is what she meant, is that the Department of Public Service and Administration set out guidance around how government officials were supposed to work. So it identified critical services, which were the equivalent of essential services in government, and shelters to service, DSD officials dealing with shelter services, children's services. Hello? Okay. Were supposed to be critical services. So they were supposed to be working. When they came back in May, they were supposed to shift to remote work, skeleton staff, shifts, and rotational systems. And by level 1, at least 75% of staff were expected to be in the office on any given workday. That is not what happened throughout the country. So you can see the active presence of DSD social workers in Western Cape, Gauteng, and parts of KwaZulu-Natal. They're there, they are trying to troubleshoot, they're giving help, they're giving assistance. I think the Western Cape stands out. They actually made an NGO services for counseling and support exclusively available to shelter workers. They said, phone whenever you need support. So that was a really excellent intervention. Only really one province who did that. Very absent provinces, Eastern Cape, Northwest, Free State, and Mpumalanga. Simply not there, never gave PPE, never gave direction. And actually all they did, the only time shelters in this province, not all of them, but most of them were saying the only time we ever heard from DSD was when they said, where are our statistics? Now they point out, we can't go out and do home-based care. We can't do community awareness raising. But the department is demanding statistics and saying we're not keeping up with our statistics. The shelter that couldn't be running work training programs because people couldn't come into the shelter had their funding cut because the department was saying, well, you're not doing the work, so you don't need the money, despite the fact they need it for all these other things. And in this particular example, those numbers, those 1,028, are not all there for GBV. Some shelters are being used to fill in gaps where DSD services were not functional. So here's an example of somebody's shelter who was doing that. And she talked about how she would get called in and they said, you'll take her. So here's to offer drug-related services, you should actually be trained, equipped, and registered. They're not. And her option from DSD was saying, she had no option to say no. It was always, you must, you have no choice. And so other shelters commented on the fact they felt abandoned. Nobody came there, nobody told them what to do. They felt completely on their own. And then I think the shelter worker who observed, we should all die equally. This was a national epidemic and a national disaster. We were all essential workers. We were all required to face the risk equally. But there was no solidarity here. And there was the expectation that we as shelter workers, our lives could be sacrificed. We could step in, and where the DSD local office closed, we could just take over their work and take the risk unequally. And I think if there is a concern, it's for the one service where shelters persistently remarked that there was an absence of DSD officials was child protection. So I do think that's something to be thought about. Then lastly, I think the comment, to me, the financial abuse from DSD was worse than the COVID. So again, we're talking about those provinces, and the standout wrongdoers here are Northwest and Eastern Cape. For 6 months, when all these increased costs were facing shelters, simply did not pay them. So, and hence the importance for the one shelter of the Charlize Theron Foundation, because in the Eastern Cape, women could not be taken in. They could be taken in for a couple of days and then had to be moved elsewhere. There was no food. People did not get paid. In the Northwest, this is a long history of dysfunction in the Eastern Cape. In the Northwest, it's been under administration since 2018. Another long history of dysfunction, didn't improve under the lockdown. Same problem. Delays reported in Free State and Mpumalanga and KwaZulu-Natal to a shelter, for example, saying they got by food parcels contributed by the local community. And you know, when there isn't food in a shelter, and there isn't soap because the shelter doesn't have the money, it sets off conflict very understandably between shelter staff and women. You can understand that there would be conflict, and that's unnecessary. And then I think in the Northern Cape, we saw the example of a shelter being converted into a shelter for homeless men. The shelter wasn't reimbursed. It's for the use, the wear and tear of that shelter. And there was a 45,000 Rand water bill that was wrapped up in the 3 months that the men were staying in the shelter. It took 6 months to get the department to refund that. We had another shelter that an individual who ran into great personal debt because she was using her personal credit card in order to be able to keep food and everything else that needed to be done to keep the shelter running.
Thanks, Lisa. So maybe you want to have your big conclusion for us.
That is the conclusion.
Okay, perfect.
The lockdown imposed new demands and additional expenses at a time when there's very limited evidence around what needed to be done and what's needed to be thought through, that you can see that there is a trajectory to this epidemic. It moves from panic to finding out a way to work out, solidarity being expressed, funding arriving, and this rapid, resourceful, and enterprising response and the establishment of a virtuous cycle, new services and new partners step in. That's the positive side, that's the presence. But then we have a shadow that is cast by the absence. And this becomes more apparent as the lockdown continues. When the state of disaster is no longer an emergency, but it's becoming the status quo. So this question of presence and absence does start to illuminate what or who is worth caring about. Because if you're not there at times of great need, it does communicate and give a message that we don't really care. And that is the message that some shelters took, that the state does not care equally about all, and that it was, in some instances, willing to abandon not only essential frontline workers, but by extension also the women and children who needed their services. Thank you. So that's just the overview of the research. Thanks, Torgo.
Thank you so much, Lisa. That was incredible. So I just want to give everybody a minute to just digest some of what you heard, and to, if you've got a pen and paper, just to write it down, and yeah, any questions, thoughts, images. I took away partly this idea of the shadow and presence and absence. So, and my big question really is how to future-proof care work and the care economy. So thank you, Lisa. So I'm going to keep quiet for a little bit. I'm right here, but you can just maybe note down your thoughts or pop them into the chat. For those on Facebook, just put them in the chat as well, in the comments.
Toko, I've also just shared the link to the policy brief, which is available for download. Now let's move on to the speakers. I'll keep monitoring the chats. Okay.
Yeah, perfect. So I'm just giving people a moment to just capture their thoughts, digest that. Okay, great. So I hope you managed to take a moment. I did note something that Lisa pointed out, that Dr. Van Niekerk also mentioned, that child protection was also not on the list of essential services. So there's an interesting theme there. And I also saw a little bit of feedback on that earlier as well. Right, so I'm really excited. We're going to swiftly move on And if I could please ask Fasani Maslangu and Mr. Sibusiso Malope to please join us, and if possible, put your cameras on. If you're still in the room, I think you were, so I'm inviting you to join us. Can you hear me?
Yes, we can hear you, madam.
Whew, I was having a panic there. Okay, so Ms. Fasani Maslangu is a qualified social worker. I hope she's on. Are you on? We're going to all chat together collectively as a three-way conversation. So if you can put on your camera and your unmute, that would be great. And maybe Claudia, if you can invite her to unmute for us. So Ms. Fasani Maslangu is a qualified social work graduate from Fort Hare, and she's registered and practicing social worker with over 12 years experience in the nonprofit sector, and has worked in a shelter for abused women and children in Mpumalanga for over a decade. And in 2019, she moved on to Mpumalanga Shelter Movement, a networking organization working with shelters and victim empowerment centers. She's also the executive member of the National Shelter Movement and its provincial representative for Mpumalanga since 2013. And Fasani's strengths is advocating and lobbying for victims of crime and violence, as well as advocating for rights of well-being of workers. So welcome, Fasani. Then we have Mr. Sibusiso Malope, who's the director of the Victim Empowerment Program from the National Department of Social Development. And he is a social work graduate from the University of Pretoria. And he started cutting his teeth in social work at the then Pretoria Children's Welfare, and has worked in both the private and public sectors, and has worked for National DSD for the last 9 years, and was recently appointed Director of the Victim Empowerment and Prevention of GBV is the Director of the Victim Empowerment and Prevention of GBV, and has completed a master's with pending research in public management and governance. Welcome to you both. So the way we're going to manage this, although I can't see you, Mr. Malope, because your screen is blanking you out. It's one of those tricks. You have to come closer to the screen. The further away you are, you can't be seen.
Change the background.
Or come closer to your camera. Your camera is not picking your face up. So what we thought would be a lovely way to engage this morning is just I will ask a few questions and talking through just a little bit of your reactions of the brief, and then to turn to some of your thoughts about where to next. So the first thing I wanted to ask is just reflecting, and this is to both of you, reflecting on the last year and a bit since the start of, well, it's almost 2 years now, since the start of the COVID-19 pandemic. Where do you find yourselves and the work that you're doing in terms of the sheltering and shelter provision? So maybe Fasani, you can go first, and then we'll have, if that's okay, Mr. Malope. So feel free to just keep yourselves unmuted if there's not too much noise in the background. It might be easier to speak freely.
Thank you so much, Toro. Thank you for the opportunity. A reflection from last year.
Oh no, we're losing you, Fasani. Are you able to?
Now, I can say.
We're losing you. Are you able to move around to get your bandwidth Or maybe put the camera off, sorry. Technology. Maybe Mr. Malapa, while we wait for Fasani to come back on, I think she might have been knocked off. What are your responses?
Maybe let me try put the camera less of the screen, much better.
Oh, sorry, okay. Give it a go, Fasani.
I was saying that a reflection by the National Shelter Movement, looking back into 2020, where the country first went into lockdown, comparing to where we are now. I would love to acknowledge that indeed 2020 was a very difficult year and an anxiety, fear-causing year. Because firstly, the pandemic coronavirus really was the first of its kind to almost everyone who's living at this time. However, when we move back to where we are now, I can safely say when lockdown started, and we attribute to this that the National Shelter Movement and its partner or member shelters received from different sectors of society, from different individuals to different private companies, donors, nationally and internationally. So I think the resources, the financial resources, and also knowledge that we received, because one should always bear in mind that you can have the financial resources, but if you do not have the knowledge, the information that is required at the time of a pandemic, it doesn't help. So I think we're at a better space now, honestly, when we look at what we know to provide better services and to arm ourselves against any other challenge that may arise, because this pandemic has actually taught us that we always need to be on guard and always need to put our houses in order for us to fight and to push forward when we're faced with such a challenge. So financial resources and the knowledge that we have received have actually assisted us to be in a better space compared to where we were when lockdown first started in the country. Thank you so much, Tony.
Thanks, Fasani. Over to you, Mr. Malapa.
Thank you so much, Chair, and good morning to all the colleagues from civil society, provincial DSD, and other partners that are in this forum. I hope I'm audible enough.
Yes.
Yeah, your question is where are we now? I must just say that, I mean, from DSD side, we are in a much better space. I want to reiterate the fact that we're faced with a situation where nobody knew what to do and how to respond or react. But what we have gained so much with the situation we found ourselves in, which we are still in, by the way, looking at the fact that now we are moving on to a fourth wave, or we've moved on into the fourth wave. We have, the gains are that we have we've gotten so much support from our principals. If you listen to all the number of address that the president has done, the issue of GBV has been elevated. And I think we can really appreciate that because that has got an advantage in terms of ensuring that moving forward to the level at which this matter has been understood. I mean, if you look even in the press that the president releases every month or every second week or so, GBV is always top of the list. With that also came the issue of having in the country declaring it as a second pandemic. So I'm thinking that we were in a situation where Treasury sometimes from our side did not really understand
I'm checking, is it frozen on my side?
No, it's frozen on mine too.
Yeah, mine too.
Okay.
Mm.
Oof, our speakers are, Mr. Malope, are you there? We lost you for a moment. Might be, Okay, shall we wait to see what happens? Just while we're waiting, Fasani, the question I wanted to ask you is, given what you've learned in this experience of providing sheltering services and reflecting on saying we need to be on guard, I was curious to sort of find out from you, looking forward, what is your one kind of big wish for the future of shelters? You can unmute yourself.
Thank you again, Togo, for this important question. Yes, we have wishes. I think once you are hit hard, as we have been hit by the pandemic, and you learn lessons and you experience things, either pleasant or unpleasant, you take lessons from that. And then you also get to have desires that arise as you continue to provide services. So in our case, as the National Shelter Movement, I would say our biggest dream or our biggest wish is for the sector. I think what can position us better going forward is for the sheltering sector in the country to have quality data collection mechanisms and be able to collect data as we go along, and the kind of data that can then be used when a research has to be commissioned and at times for evidence purposes. Because when you have data that is ready, you are at a position where you can always supply it to whoever needs to support you, whether with information or with resources. So I think our biggest wish is to have that mechanism that can then make sure that we have got quality data at our disposals. And then another wish, I think this one is very important, is that the National Shelter Movement, we desire to be recognized in the country as a key expert when it comes to sheltering services in the country, because I think it was reflected when Lisa was presenting that before lockdown, before the pandemic was pronounced, we're sitting at 78 member shelters, but that number rose to 98. And I think it is going to continue rising. So when you are organizing or when you're coordinating such a high number of shelters in the country, it means when you are pulling from knowledge and from information that is supplied by all those members, you become at a better position, you become at an advantage to know what is working and what isn't working, what is needed and what is not, what is essential and what is not. So we desire to be recognized in the country as an expert when it comes to sheltering services. And of course, want to do this in partnership with other departments and other stakeholders who also have got an interest in the sheltering sector in the country. So I'll leave it there.
Great. Thanks, Fasani. I don't think Mr. Malope has rejoined, so it's a real pity because he was about to touch on Treasury, which we had it's kind of one of the key aspects of this conversation. So I think we'll wrap up this just in terms of the limitations we're experiencing with tech, which happens. This is part of what we are experiencing now. So I had one last question, Fasani, around the brief, actually, and just reflecting on whether there's anything that you felt is missing. Are there questions we are not asking?
Okay, thanks, Togo. Yes, after going through the brief, I just picked up quite a few things that stood out that maybe the brief isn't responding to, but nonetheless, I'll just share them here. One of those is the issue that these shelters, by virtue of being non-profit organizations, exist in communities where we have different stakeholders and different partners in those communities. So when we see, when it is shown that right at the beginning of the pandemic, everyone found themselves in a want of answers, in a want of information, guidance, and protocols and all that. But no one could provide those. So what the brief didn't really bring out then that is important is what are local stakeholders and partners to shelters are saying about this. And I just hope then this reminds us that the brief should not only end at this platform, but it should filter down to shelters at local level so that they share with their board members, they share with their local partners and stakeholders, so that each person, each individual, and each partner begins to ask themselves, what role could I have played to ensure that these services are not interrupted or this anxiety is minimized or is lessened? Because anxiety could have been maybe much better to shelter workers or to people who were minding the shelters at the time, if maybe different partners came on board and said, I'm a board member, I'm coming from health, this is what we know, and this is where we can actually assist. I'm a police official, or I'm a CPF member, or I'm a private sector member of this shelter. This is how much PPE I can bring to the shelter for it, at least to keep the work going and also try and ensure there's lessened anxiety. So I think it's important that we also filter it down to our partners at a local level. And also one last thing that I also picked up is that continued power, or let me call them unequal relations, continue to exist between non-profit sector and government. I don't know whether by virtue of being a not-for-profit organization, then just places one at a disadvantage or what. But I think we should move towards advocating and lobbying for making sure that at least these relations get to a point where they are much better. I don't know whether we're going to ever get a balance that is equal relations between government and the private and the non-profit sector. But I think the brief shows that really relations are not equal. And that is very dangerous, because it means when we have so many citizens relying on services provided by the non-profit sector, but we find that the provider of that service is at a lesser advantage compared to their government counterpart. It is very dangerous to continue with such relations. So I think there is work for the National Shelter Movement in partnership with other non-profit actors to try and ensure, and I think BSD's professor is here also, and others, to say, I think we should move towards a point where we create good relations, a balance of power between the non-profit and government, because all our efforts are towards ensuring that citizens in the country receive a quality service. So I think that is very important. Thank you so much.
Thank you so much, Fasani. And I'm really pleased to see that Mr. Malope is back. And I was just saying, when we lost you, you were about to touch on one of the most kind of critical components of this conversation. And Fasani's just touched on it a little bit as well, in terms of the funding of shelters and the financing, the role that DSD plays. So I just wanted to quickly ask you, before we open up to the broader audience and participants in the webinar, was in terms of DSD's planning and next steps, you know, kind of what is the DSD's thinking to strengthen shelter services, both recognizing the power imbalance, the nature and shape and form of the different shelters that are providing sheltering or are financed in different ways. And then a more concrete question is kind of how will National DSD support shelters in ensuring that at a provincial level that they are receiving equally the subsidies on time, in order to be able to deliver the services that they are required to do. So just 25 questions and one question for you. So over to you, Mr. Malope.
Thank you. Yeah, thank you, colleague. And sorry, I got cut off. I don't know what happened, that I went offline. I hope you got my first response regarding where are we now, because I think that is critical to understand that our issue of fighting gender-based violence are in a much better, we are in a much better space now before, if you look at it before the COVID situation. Obviously, we cannot really capitalize on that as a good thing as such, because we didn't want COVID for us to understand the scourge of gender-based violence better, but it has really brought much more light. And I think beyond this, we should be realizing a lot of things that in a long time we could not. The department, together with the Department of Public Works and Infrastructure, initiated a project that is looking at getting infrastructure or buildings from public works that are earmarked for the benefit of victims of GBV. And these are buildings that are found across the country. And I'm talking about former houses that were utilized by government officials such as SAPs, your former judges and so forth, which the department is currently in the process of identifying across the country and find out which ones will be habitable to actually be allocated for sheltering services. These are buildings that won't necessarily or immediately be utilized or be converted into buildings that DST will use, but the plan is to actually allocate those buildings to CSOs to operationalize, which I think it's one of the strengths that we would have. And I'm not saying that CSOs do not have infrastructure, but this will add on to our issues of infrastructure, especially because the very same time during this period of COVID as well, we realized that in the country, out of the 52 districts that we have about 8 districts where we do not have shelters. So this is one of the projects that will really strengthen ensuring that we've got shelters across all districts in the country. And we know that districts are very vast. A single shelter in the district with our huge problem of GBV might not be enough, but at least we'll make sure that we have a shelter in every district. Within the same project as well, we're looking at strengthening by having more Khuseleka one-stop centers established across the country. We have currently 3 Khuseleka one-stop centers. We are currently looking at one that is a model that is considered for the Western Cape, and then we'll be looking at across the other provinces. So basically, we currently have Northwest, Northwest, Limpopo, and Western Cape being considered, as well as Eastern Cape. So the other 6 do not have Khuseleka. So we're looking at strengthening that. Funding-wise, Chairperson, in a nutshell, I would say the department approved we call it the sector funding model that is looking at creating parity. Whether it will do so, we will still see in the implementation of it, but it's one of the policy documents that will assist in ensuring that shelters are funded equitably, if I can put it like that. I heard my other colleague Fasani talking about parity in terms of ensuring that the same
We've lost you. Are you there? Did he drop? We are totally unlucky today.
Now we can open up to some questions.
Yeah, apologies, because I know there was a question, that follow-up question in terms of the 8 districts. So Claudia, you will note that and maybe ask by email.
Yeah.
Okay.
Definitely.
Perfect. So if he does rejoin or comes back, just maybe just send him a message to say we're just looking at the time. So my apologies. I wish I was able to control the interwebs, so such things would not happen. But we're really pleased to see that many of you have been able to stay on the call and on the webinar. And now we're going to open up to the broader grouping. And please forgive me if I interrupt you, because my job now is to just enable us to have as many voices, but also to watch the time. I think we probably needed a 2.5-hour session as opposed to a 1.5 hour session. So please raise your hand or indicate in the chat that you would like to speak, and then I will invite you to chat. Yes, I wish, Mr. Malope, that we could control your network because we were after you. There was one direct question around maybe if you can provide the list of the 8 districts who do not have a single shelter. So I'm not seeing any hands yet, unless I've missed them. If you need to know how to raise your hand, you go down to the reactions. If you're on your laptop, you will see a little thing saying reactions with a little smiley face and a plus sign. Click on there and you'll see the raised hand function. And I'm not too sure how it works on the cell phones, because it depends on the cell phone.
So cool. Oh, sorry. So go ahead.
I see Spoo's giving us a list of, it looks like some of the list of districts that don't have shelters. So he's said in the Northern Cape, Namakwa and John Paolo Festiwe. My apologies for how I pronounce that. Zululand in KwaZulu-Natal, which I think takes us to 3. So Spoo, if you can give us the other 5, that would be great.
Thanks, Sybil.
I was just wondering if I can come in here. I know initially we had Jessie from the Charles Theron Foundation who had RSVP'd. I wonder if she's in the room and whether she could just talk to us about, what was the need for supporting and how they felt about supporting the national shelter movement and whether this will continue without facing any particular pressure. We also have other donors in the room. I think OSF was going to join us, the Solidarity Fund, the GBV Fund. So if any of those representatives are in the room, it'd be really amazing to hear from you. Just in terms of the chat, we've had a lot of confirmation from shelters saying this was really the reality for us on the ground. We also had Joan van Eck from the children's sector saying very similar issues. And this, as Karen pointed out, will continue what happens post the pandemic. Will support continue.
Yeah, and we will be having a follow-up paper, and the suggestion is to have a session early, beginning of 2022.
Just to add some more districts that don't have shelters in the Northwest, we have Dr. Kenneth Kaunda and Khaka Modiri Molema. In the Free State, Kharib. In Limpopo, Waterberg and Sekukune. I think that comes to 8. Yeah.
Okay, so I'm going to, as a facilitator, you can use silence in many ways. One is to allow people to reflect and be quiet. Or alternatively, you can say, gosh, there's quite a lot going on. And because there's a rush, it makes things a little bit difficult. So what I'm going to do is I'm going to quickly, I've seen. So I'm going to take the pressure off you all, because I suspect we will need to come back next year, because this is the beginning of the fourth wave and we don't quite yet know what it's going to look like. But we also know, and I'm abusing my role as the chair, and Lisa knows this, and Claudia knows this, and Mr. Malope knows this, that we have got a medium-term budget policy statement that indicates very clearly that this, at a financing side of things, from a budgeting side of things, that we are in austerity budgeting, that there hasn't been the prioritization for social services. So yes, for sheltering, but also for social development outside of the social grants, which is another conversation. But there is a huge impact coming our way in years upon years of underfunding for social services. And so part of the work that is important to consider in this conversation is to look at the importance of the care economy, or the well-being economy, however you want to talk about it. And Lisa has been talking about this for many, many years. And many of you are raising it as an issue. So I think, Mr. Malope, one of the things I wanted to put you on the spot on is that you mentioned that the principles, so the political leadership is saying the right things, but we're not seeing it on the ground when it comes to noughts and rands, right? So rands and cents. So over to you to tell us what we can do to help you get the budgets that you need. Plus your hand up. You can unmute.
Thank you, Chair. And I'm feeling bad now because this network is a bit unstable. And I really hope I will be quite brief and quick so that it don't take too much of your time. I really would have loved to also share what happened at National, when the COVID pandemic started, but the time doesn't allow us.
It's not your day, Mr. Malope. Just can't hear you.
But what I can say around what is it that you can help us with. I heard the report actually talks to the fact that we are very much very much strong in requesting.
Yeah, I'm so sorry. We can't hear.
Reporting.
Yeah, we can't hear you.
You can't hear me.
We desperately want to hear you. So maybe just pop it in the chat.
I am sorry, Chair. I will type.
Yeah. Okay, so what I would like everyone to do on the call, you've been very patient. Thank you very much. Please, if you're in a safe place and you can and you feel comfortable, please put your camera on. And I would like to do a little exercise with you all, and you can unmute. So let's make some noise. It's a very unnatural thing to be in this like silent space. So unmute yourselves. If we're hearing chickens or children or cars, we don't care. Let's get that noise into the room. Right. Now, if you feel comfortable, I would like you, and I'm taking up Claudia's time because she's going to say, thank you, it's been real. See you in 2022. So, what I want you to do is put your hands on your shoulders if you can and you're safe. If you're driving, please keep your hands on the steering. And I want you to make a circle, just like this. Okay. And I want you to breathe in and breathe out, because actually, the amount of care work, the amount of essential work that these shoulders provide, from working with children, dealing with gender-based violence, dealing with homelessness, dealing with panic. These shoulders are broad and they are big and they are strong. So I want you to repeat after me. My shoulders are strong.
My shoulders are strong.
Okay. And I want you to put your hands on your heart.
Yes.
Take a deep breath in. And say, my heart is supported by this community and so many.
My heart
is supported by this community and so many.
Okay, and then I want you to put your hands out in front of you. I want you to share the energy that is going to be needed for 2022. So right now, you're preparing the energy for everybody on this call.
I'm throwing mine.
Incredible work. You hand it over. Give it a go. Say, Lisa, we need your brain. Say, Anna, we need your glasses to see. Jessica, we need your
courage.
Yeah, hand over that.
Anna, we need your good health.
Okay.
Hello, Anna, we need your good health.
I need your brain.
Jessica, we need your money. Okay, just throw it out there. Claudia, we need your cash.
Claudia,
Right.
I need your intelligence.
Okay.
Where are my loves? I give
All
love.
right, everybody, I'm so sorry for the technical challenges. Please know on behalf of the Heinrich Böll Foundation that we are very honored and just knowing how critical this work is. And I can tell you that I sit in meetings where I wish I could send you all off to my partners in other offices because they are grappling with these issues in repressive environments. And so what you do does not go unnoticed. What you say does not go unheard. What you see is shared. So over to you, Claudia.
Yeah, so a very quick thank you to everybody who joined us. Thank you to the researchers who have really committed their time and energy and effort and insight and love for this project. Thank you, Toko, for stepping in at the last moment. Thank you to the speakers. Sorry we couldn't hear you so well, but Fasani, you were absolutely brilliant. We heard you, we felt you. And to the NSM executives, thank you so much. Thank you to the shelter, the provincial reps. Thank you to the shelters, I mean, that participated in this research. Big thank you to your time, your voice, your opinions, sharing of very personal experiences of providing shelter to so many needing love and care. We all have the greatest respect for you, and I think you deserve an absolute round of applause for being the amazing people and organizations that you are, and to the funders who support this work, and to the departments that do carry the same care and love. Thank you all. Please.
Go well. Thank you, everyone.
Thank you.
Thank you, everyone.
Bye.
Bye.
Bye.